Hi there, thank you for joining this video about snoring and obstructive sleep apnea. I thought this would be a good topic because obstructive sleep apnea can have a massive effect on people's quality of life, yet easily will often go undetected. My name is Martin Benfield, I live in Redbourne. I am a GP at a practice in Welwyn Garden City, and I've done sessions at Hemmel's Urgent Care Centre for the last 12 years or so. So in this video we're going to talk about what obstructive sleep apnea is, what sort of symptoms a person might have if they've got the condition, what you can do about it, and what might happen if you went to your GP. So obstructive sleep apnea is where there's obstruction in airflow from the nasal passages down the back of the throat, past the back of the mouth and down into the lungs when you're asleep. Now most commonly that's the tongue flopping backwards against the throat. The obstruction as air is flowing causes noise, which is snoring. Sometimes the obstruction can be complete and it will stop the person breathing for a few seconds before their muscles kick in and the person will gasp or choke. Occasionally they may wake up and remember the event, but they're probably going to have hundreds of these episodes for every one that they remember. The reduction in airflow causes a reduction in oxygen in the lungs, causing a reduction in oxygen in the body, which then will stop the body being able to regenerate itself as well as it should do and refresh the person overnight, particularly affecting the brain. Now, people with obstructive sleep apnea are going to feel fatigued, they'll feel tired during the day, they'll have reduced cognitive function, so they won't be able to think and work things out as well as they should do, and may even start feeling low and depressed because of it. I tend to find that people present in two different ways if they've got symptoms that make me think of obstructive sleep apnea. So the first would be, I'm feeling tired all of the time and I don't know why. I go to bed at a decent time, I wake up okay, I don't wake up too early yet. I feel like I haven't had a long sleep when I wake up, and I kind of feel a bit headachy at times, and I feel like it's affecting my work now. I'm not thinking properly, I can't work things out like I used to, I forget things, and it's actually started to make me feel a bit low and depressed because of it. The other way is people presenting with snoring as the primary issue. So that will often go, I've been told to come in today because of my wife. My wife says if I don't sort out my snoring, I'm going to be sleeping in the spare room from now on. She says I'm always snoring, keeps her awake, and then when I'm asleep, I pause, I stop breathing for a few seconds, I do a big gasp, and she hates it. I have to say I too tend to wake up with a dry mouth and a bit of a sore throat a lot of the time. So obviously if you're a snorer, not all snorers have obstructive sleep apnea, and not everyone who is tired more than they'd like to be has obstructive sleep apnea, but if you don't think about it, then it's not going to be detected, particularly the tired all the time type symptom. There's far more common conditions such as underactive thyroid, anemia, stress, depression than obstructive sleep apnea, but it's worth thinking about. So if you are a snorer, or you are much more tired, or feel like your memory's not as good as it used to be, think about those other symptoms. So if you're either way, actually ask someone else. We don't know what our sleep is like because we're asleep, so ask someone else. Is there someone else who could tell you what's your sleep like? Do you snore? Do you have those pauses? If you don't, then set up your camera, your video on your phone to record yourself. Do it 2 or 3 times, watch it back, see if there's any evidence that you snore or you pause when you're breathing. Definitely worth doing as the first step. The next thing to do, think about those other daytime symptoms. Do they apply to you? And then after that, think about other things that might be contributing. Do you have any problems with your nasal passages? Do you generally have a blocked nose? Do you have difficulty breathing through your nose? Family history is usually important in most medical conditions. So find out, is close family members, particularly brothers, sisters, mum, dad, if someone in your family has got obstructive sleep apnea and you've got symptoms, you've got to do something about it. You've got to take this on. Also ask about problems with the nasal passages. Have you got close family members who, as an adult, have had adenoids, tonsils removed, have had operations on the sinus area? The next thing you do is work out a score of how tired you are during the day. There's a way of doing this using the Epworth Sleepiness scale. So Epworth is spelled Epworth, and there's a good version of this questionnaire on the British Lung Foundation website. It does a series of questions, and it gives you a score of how tired you are during the day. Is really useful when we do referrals to the sleep clinic, and also can be useful when you've tried something to try and help with your symptoms. If, let's say 6 months ago, you want to compare with how tired you are now compared to then, it's very hard to remember back very accurately about how tired you might have been. But if you've got a score to add to that, it can add to the evidence of how your condition has changed. There are some factors which link with both snoring and obstructive sleep apnea that are worth trying to do something about to see if they improve your sleeping and your symptoms. First is smoking. Now, hopefully I don't need to advocate the reasons why it's good to not smoke. Maybe if you're a smoker and you have symptoms of obstructive sleep apnea, that might be the final push to help you to try and give up. If you can, then great. Next thing is weight. The more weight you have around the neck, the more pressure there is on the throat, and the more likely you have obstructive sleep apnea. If you can lose enough weight to reduce some of that weight around your neck, it may cure all of your symptoms. It's definitely the thing to do if you can. Anything that increases how deep a person's sleep is, or how active their nervous system is overnight, will cause more obstructive sleep apnea. In particular, this would be alcohol. So try not to drink any alcohol in the evening if you can. You might have a drink with evening meal instead, and then not drink anything out of that after that, so that you don't have any symptoms overnight. The other thing in this area is medicines, most importantly with the opioids. So they're things like morphine, tramadol, codeine. These drugs are very rarely of any benefit with long-term pain, and there's good evidence they actually make the conditions worse overall. So if you can reduce down the dose gradually and then stop them at least the evening dose, then you can compare and see if that makes any difference for your sleep and your quality of life. The last thing is to not sleep on your back. Now, if you're sleeping on the back, it's more likely your tongue is to flop backwards and obstruct. So a couple of methods I've seen to try and reduce how often a person is sleeping on their back. One is to strap a tennis ball to their back, usually with tape. I've seen a few people try it. I haven't seen many people persevere with it, but it's worth a try if you wanted to. The other way, which seems to be more palatable, is to have a series of cushions down both sides of you, so that you have to lie on the side you can't lie. There's not enough space to lie flat. So that's worth trying. Some of these conditions, some of these methods may act very quickly. So not drinking alcohol in the evening, not sleeping on your back may have a very quick effect. Other ones like weight loss may take longer. So if you're going to make a change, try and stick with it for as long as you can, see if it can make a difference. The next thing to look at is whether you've got any conditions, and this is getting a bit more medical, regarding the nasal passages that might need treatment. So if you've got any allergy type symptoms, so you often suffer from itchy eyes, sneezing, you have eczema type conditions, it's worth trying an antihistamine for a couple of weeks. So the best one is probably something called Cetirizine, which you can get direct from the pharmacy. It's a hay fever medication. It's spelled C-E-T, Cetirizine. And what you do is take one a day for a few days. If you notice any change in symptoms, try and find the lowest dose that keeps having the same effect. So you might take it every other day and then every third day, and use that for a couple of weeks to see if it makes any difference to any of your symptoms. If it does, then great, you can carry on a bit longer, and then maybe see your GP about the condition if you felt like you needed some more advice going forward long term. If you don't have those symptoms, it's still worth trying a nasal steroid spray. Now, nasal steroid sprays you can get direct from the pharmacy. There's a type called beclometazone nasal spray. The brand, which is more expensive than the non-branded version, is Beckanase, that a lot of people might have heard of. And the pharmacist can help you with that if you don't see it, obviously, on the shelf. what you do 2 sprays to both nostrils twice a day, and you keep that going until you feel like symptoms are improving, and then you cut it down to once a day, and then 1 spray once a day, and then you can stop it to see what happens, and you can restart again if symptoms start to come back. The way to use it is it's a bit like an asthma inhaler, except it's got a smaller nozzle that goes up your nose rather than into your mouth, and you aim it directly up there. You hold your breath as you spray it, and then afterwards breathe in and out through your mouth, trying to give the particles as long as possible to stick to the nasal passages, trying to shrink down those the inside lining of the nasal passages and sinuses in the back of the throat to try and allow the obstruction to be reduced. If you've done all of those things and you still have symptoms of obstructive sleep apnea, then it's worth contacting your GP next. Currently, the best way to contact your GP with this kind of thing would be to use their online access. Now, most GP practices on their website will now have a way that you can write down your symptoms or what you're asking for and submit it via their website. This way, it gives you time to write down everything you want to. You're not pressurized by having a phone call or face-to-face where you have to think of everything at the time. You can take your time, work out your timeline of symptoms, what you've tried, how well they've worked, and then you can submit that, and somebody from the practice will give you a call back and talk you through it further. So at that stage, once you get to speaking to the GP, the question is probably going to be where to refer you to next regarding your symptoms, and this will usually be to the sleep clinic. However, you may consider going to the ear, nose and throat team if your sinus symptoms are present and they haven't changed with the treatments you've tried so far. Then that may be the first option. Some people don't tolerate Beckinase, or certain nasal sprays can make their nose a bit sore, so the GP may try an alternative nasal steroid first. It can take about 6 weeks to see an effect, so you've got to keep persevering. It's not like an antibiotic where you might use it for 1 week and everything's cured. You've got to use it for at least 6 weeks before you can decide whether it's made any difference or not. People always need to have tried a nasal steroid before referral on to these services, so it's definitely worth doing this first of all. So once you're at the sleep clinic, they'll be able to do a sleep study where they set you up with some gadgets. It will measure your oxygen levels and record the quality of sleep, the pauses in your sleep overnight, and will then be able to decide whether you've got obstructive sleep apnea or not. If you do, there are 2 treatments that will be tried. One is a mouth brace, a bit like kind of a gum shield thing, and it helps bring your jaw forward, try and prevent the tongue from flopping backwards and causing the obstruction. There are some dentists who can make this for you. Now, if you're a snorer, you feel that that's affecting you, or maybe more your partner, but you don't feel you have the other symptoms to suggest obstructive sleep apnea, it's worth going to your dentist to find out if that's something they can offer, or they know how you can sort that out. The other thing from the sleep clinic will be a CPAP machine. Now, that stands for continuous positive airway pressure. It's a mask that kind of fits over the nose, and it blows air constantly into the nose, down the throat, keeping the airways open and allowing the airflow to be better, keeping the oxygen levels up and reducing what those symptoms are like overnight. Now, as you can imagine, having a mask on your face while you're trying to sleep with air blowing up your nose isn't as palatable as some of those other options we've talked about. So it's definitely worth trying all those things first. But for those people who have significant obstructive sleep apnea symptoms and have tried everything else, this CPAP mask can be life-changing. So it's worth persevering with these other things first and then moving on to this as a treatment option. So I hope that was useful for you. So have a think about obstructive sleep apnea symptoms if you or a family member is a snorer or is complaining about tiredness a lot during the day. Thank you. Goodbye.